Question 1. Which of the following is the generic name for the brand name drug Zoloft? A. Fluoxetine. B. Sertraline. C. Paroxetine. D. Citalopram. Answer: B. Sertraline. This question tests your knowledge of common brand and generic drug names, which is essential for dispensing medications accurately. The brand name Zoloft is widely recognized for treating depression and anxiety. Its generic counterpart, required by law to be bioequivalent, is sertraline. Knowing these common pairings helps avoid errors in the pharmacy and ensures patients receive the correct medication. Remember that generic names are usually lowercase and describe the active ingredient, while brand names are capitalized and marketed by the manufacturer. Question 2. A prescription calls for 100 milliliters of a liquid medication to be taken at a dosage of 5 milliliters twice daily. How many days will this prescription last? A. 5 days. B. 10 days. C. 15 days. D. 20 days. Answer: B. 10 days. This is a basic pharmacy math calculation involving quantity, dose, and frequency to determine the duration of a prescription. The patient takes a total daily dose of $5 / ml / dose / times 2 / text doses / day equals 10 / ml per day $. With a total quantity of 100 milliliters, the prescription will last for $100 / text ml / 10 / text ml / day equals 10 / text days $. Always calculate the total daily amount first, then divide the total quantity by the daily amount to find the number of days' supply. Practicing these simple calculations is key to ensuring patients have enough medication until their next refill. Question 3. What is the primary purpose of a MedGuide, medication guide? A. To provide a complete list of all possible side effects. B. To educate patients about specific risks and instructions for certain medications. C. To serve as a substitute for the pharmacist's counseling. D. To detail the manufacturing process of the drug. Answer: B. To educate patients about specific risks and instructions for certain medications. MedGuides are FDA-approved documents designed to provide important information to patients about certain medications that have specific risks. They are not meant to replace pharmacist counseling but rather to supplement it by highlighting serious side effects, proper usage, and warnings. MedGuides are mandatory for some drug classes to ensure patients are fully informed about how to take their medications safely and effectively. Think of a MedGuide as a crucial safety pamphlet for drugs with potential dangers you need to be aware of. Question 4. According to federal law, how long must most records concerning the dispensing of controlled substances be kept readily available for inspection? A. 1 year. B. 2 years. C. 3 years. D. 5 years. Answer: B. 2 years. This question tests your knowledge of federal regulations governing controlled substances, specifically record-keeping requirements. The Drug Enforcement Administration, DEA, mandates that pharmacies maintain records for a minimum of 2 years for Schedule II, III, IV, and V substances. These records are critical for tracking controlled substances and preventing diversion. Keeping meticulous and accessible records is a fundamental part of compliance in the pharmacy setting. Question 5. What is the correct way to measure a liquid volume in a graduated cylinder? A. By reading the measurement at the highest point of the liquid. B. By reading the measurement at the bottom of the meniscus, the curve of the liquid surface. C. By estimating the measurement between the calibration marks. D. By filling the cylinder to the brim. Answer B. By reading the measurement at the bottom of the meniscus, the curve of the liquid surface. When measuring liquids in a graduated cylinder or similar glassware, surface tension causes the liquid to curve, forming a meniscus. For most liquids, like water or aqueous solutions, this curve dips down in the middle. To ensure accurate measurement, you should always read the volume at the lowest point of this curve, which is the bottom of the meniscus. This standard technique is vital for compounding medications accurately and maintaining quality assurance. Question 6. Which of the following is a common side effect of atorvastatin, Lipitor? A. Cough. B. Muscle pain, myalgia. C. Nausea. D. Dizziness. Answer B. Muscle pain, myalgia. Atorvastatin, commonly known by the brand name Lipitor, is a statin medication used to lower cholesterol. A well-known potential side effect of statins is muscle pain or weakness, medically termed myalgia or myopathy. While other side effects like nausea can occur, muscle pain is a particularly important one for patients to report to their doctor. Always be aware of common side effects for frequently prescribed medications like statins to help patients understand what to watch for. Question 7. Calculate the quantity of a medication needed for a 30-day supply if the dosage is 2 tablets 3 times a day. A. 60 tablets. B. 90 tablets. C. 120 tablets. D. 180 tablets. Answer D. 180 tablets. This is another dosage calculation problem to determine the total number of units, tablets, needed for a specific duration. The patient takes $2 \text, tablets/dose, \times 3 \text, doses/day, equals 6 \text, tablets per day, $. For a 30-day supply, they will need $6 \text, tablets/day, \times 30 \text, days, equals 180 \text, tablets, $. Break down the calculation by finding the total daily dose first, then multiplying by the number of days. Accurate quantity calculations are crucial for dispensing the correct amount of medication. Question 8. Which government agency is responsible for enforcing the Controlled Substances Act, CSA? A. Food and Drug Administration, FDA. B. Federal Bureau of Investigation, FBI. C. Drug Enforcement Administration, DEA. D. Centers for Disease Control and Prevention, CDC. Answer C. Drug Enforcement Administration, DEA. This question asks about the federal agency responsible for regulating controlled substances. The DEA is the primary agency tasked with combating the illegal distribution and use of controlled substances and enforcing the regulations outlined in the Controlled Substances Act. While the FDA regulates drug approval and safety, and other agencies have roles in public health, the DEA specifically oversees controlled substances. Understanding the roles of different federal agencies is important for knowing which regulations apply in specific pharmacy situations. Question 9. What is the primary role of a pharmacy technician in maintaining inventory? A. Deciding which new drugs the pharmacy should stock. B. Counting stock, checking expiration dates, and organizing medications. C. Negotiating prices with drug wholesalers. D. Counseling patients on medication costs. Answer B. Counting stock, checking expiration dates, and organizing medications. Pharmacy technicians play a vital role in managing the pharmacy's inventory to ensure medications are available and current. This includes tasks like receiving new stock, counting current quantities, rotating stock to use earlier expiring items first, and identifying and removing expired medications. While pharmacists handle clinical decisions and financial negotiations, technicians are essential for the day-to-day operations of keeping the shelves stocked and organized. Good inventory management directly impacts patient care by ensuring medications are available when needed. Question 10. Which of the following is the generic name for the brand name drug Prinaval or Zestrol? A. Lisinopril. B. Losartan. C. Amlodipine. D. Valsartan. Answer: A. Lisinopril. This question tests another common brand generic pair, focusing on medications used to treat high blood pressure. Lisinopril is an ACE inhibitor sold under the brand names Prinaval and Zestrol. These brand names are less common now that the generic is widely available, but recognizing them is still important. Knowing the generic names of top prescribed drugs is fundamental for a pharmacy technician. Question 11. Convert 500 mg mg to grams g. A. 0.05 g. B. 0.5 g. C. 5 g. D. 50 g. Answer: B. 0.5 g. This is a unit conversion problem within the metric system, which is fundamental in pharmacy calculations. There are 1,000 milligrams in 1 gram. To convert milligrams to grams, you divide the number of milligrams by 1,000. So, $500 \text mg/1000 \text mg/g equals 0.5 \text g $. Mastering metric conversions is critical for calculating dosages and preparing medications accurately. Question 12. What information is typically found on a drug's National Drug Code, NDC? A. Patient's date of birth. B. Drug manufacturer, product, and package size. C. Prescribing physician's DEA number. D. Medication's expiration date. Answer: B. Drug manufacturer, product, and package size. The NDC is a unique 10 or 11-digit code assigned to each drug product in the United States. It acts like a barcode for medications. The code is segmented to identify the manufacturer, the specific drug and dosage form, and the package size. This code is essential for billing, inventory, and verifying the correct medication. Think of the NDC as the drug's unique identifier, ensuring you're handling the right product. Question 13. In a hospital setting, what does the abbreviation STAT on a medication order signify? A. Administer within 24 hours. B. Administer at bedtime. C. Administer immediately. D. Administer as needed. Answer: C. Administer immediately. STAT is a medical abbreviation derived from the Latin word statum, meaning immediately. When a medication order is marked STAT, it indicates a critical need for the drug to be administered to the patient as quickly as possible. Recognizing and prioritizing STAT orders is vital in pharmacy practice, especially in hospital or urgent care settings, to ensure timely patient care. Always treat STAT orders with the highest urgency. Question 14. Which schedule of controlled substances has the highest potential for abuse and no accepted medical use? A. Schedule 1. B. Schedule 2. C. Schedule 3. D. Schedule 4. Answer: A. Schedule 1. The Controlled Substances Act categorizes drugs into 5 schedules based on their potential for abuse and accepted medical use. Schedule 1 drugs, such as heroin and LSD, are defined as having a high potential for abuse and no currently accepted medical treatment use in the United States. Understanding the controlled substance schedules is fundamental for handling, dispensing, and inventorying these medications legally and safely. The lower the schedule number, e.g., I versus V, generally the higher the potential for abuse. Question 15. What is the purpose of a look-alike, sound-alike, LASA drug list? A. To identify drugs that treat similar conditions. B. To highlight drugs that have similar names or appearances to prevent medication errors. C. To list drugs that are available in different dosage forms. D. To categorize drugs by their therapeutic class. Answer: B. To highlight drugs that have similar names or appearances to prevent medication errors. LASA drugs are a significant source of medication errors because their names or packaging can be easily confused. Pharmacies and hospitals maintain LASA lists and implement strategies like using tall man lettering, e.g., prednisone versus prednisolone, to differentiate them. Awareness of LASA drugs and using error prevention techniques is a crucial quality assurance measure to protect patient safety. Always double-check the name and appearance of medications that look or sound similar. Question 16. A patient needs to take 40 units of insulin daily. The insulin is available as 100 units/ml. How many milliliters should the patient inject daily? A. 0.04 milliliters. B. 0.4 milliliters. C. 2.5 milliliters. D. 4 milliliters. Answer: B. 0.4 milliliters. This is a dosage calculation involving insulin concentration. The order is for 40 units, and the concentration is 100 units per 1 milliliter. To find the volume needed, you divide the desired dose by the concentration, $40 \text, units, /100 \text, units/ml, equals 0.4 \text, ml, dollar. Always pay close attention to the units and concentration when calculating doses, especially for high-alert medications like insulin. Question 17. Which type of recall is issued when a drug is unlikely to cause adverse health consequences? A. Class 1 recall. B. Class 2 recall. C. Class 3 recall. D. Market withdrawal. Answer: C. Class 3 recall. Drug recalls are classified by the FDA based on the potential health hazard posed by the product. A Class 3 recall is the least serious type, used when a product is unlikely to cause temporary or serious adverse health consequences. This might be for issues like minor defects or labeling errors. Understanding recall classifications is important for knowing how to handle and remove affected products from the pharmacy. Question 18. What is the generic name for the brand name drug Norvasc? A. Lisinopril. B. Metoprolol. C. Amlodipine. D. Atorvastatin. Answer: C. Amlodipine. Norvasc is a calcium channel blocker commonly prescribed for high blood pressure and angina. Its generic name is amlodipine. Recognizing this common brand generic pair is part of knowing the top 200 drugs. Continuously studying and reviewing brand and generic names will help you quickly identify medications during dispensing. Question 19. A prescription reads, "Take 1 tablet PO bid." What does PO signify? A. By injection. B. By mouth. C. In the ear. D. Applied topically. Answer B. By mouth. This question tests your knowledge of common medical abbreviations used in prescriptions. PO is a widely used abbreviation from the Latin per os, meaning by mouth. Understanding these abbreviations is crucial for accurately interpreting prescription orders and ensuring the patient takes the medication correctly. Always clarify any abbreviations you are unsure about to prevent medication errors. Question 20. What is the primary goal of a pharmacy's quality assurance program? A. To increase pharmacy profits. B. To identify and prevent errors and improve patient safety. C. To reduce the pharmacist's workload. D. To speed up prescription filling time. Answer B. To identify and prevent errors and improve patient safety. Quality assurance in a pharmacy focuses on establishing processes and procedures to minimize errors and ensure the highest level of patient care and safety. This includes things like double-checking prescriptions, maintaining accurate records, and implementing error reporting systems. The ultimate goal is to continuously improve the quality of services provided and protect patients from harm. Quality assurance is a fundamental aspect of responsible pharmacy practice. Question 21. Convert 2.5 liters, L, to milliliters, ml. A. 25 milliliters. B. 250 milliliters. C. 2,500 milliliters. D. 25,000 milliliters. Answer C. 2,500 milliliters. This is another metric unit conversion, converting liters to milliliters. There are 1,000 milliliters in 1 liter. To convert liters to milliliters, you multiply the number of liters by 1,000. So, $2.50 L times 1,000 text ml/L equals 2,500 text ml $. Be comfortable converting between different metric units as it's a common task in pharmacy. Question 22. Which law required all medications to be pure, safe, and effective? A. Pure Food and Drug Act of 1906. B. Food, Drug, and Cosmetic Act of 1938. C. Durham-Humphrey Amendment of 1951. D. Kefauver-Harris Amendment of 1962. Answer D. Kefauver-Harris Amendment of 1962. This question tests your knowledge of significant pharmacy legislation. The Kefauver-Harris Amendment was passed in response to the thalidomide tragedy and mandated that drug manufacturers prove their drugs were not only safe but also effective before marketing them. While earlier laws addressed purity and safety, this amendment added the crucial requirement of proving effectiveness. Understanding the history of drug law helps explain current regulations. Question 23. What is the generic name for the brand name drug Synthroid? A. Metformin. B. Levothyroxine. C. Atorvastatin. D. Omeprazole. Answer B. Levothyroxine. Synthroid is a very commonly prescribed medication used to treat hypothyroidism, an underactive thyroid. Its generic name is levothyroxine. This is a critical brand generic pair to know due to the drug's high usage. Familiarity with the most frequently dispensed medications and their names is essential. Question 24. What is the minimum age to purchase pseudoephedrine products without a prescription under federal law? A. 16 years old. B. 18 years old. C. 21 years old. D. There is no federal age restriction. Answer B. 18 years old. Federal law, specifically the Combat Methamphetamine Epidemic Act, CMEA, of 2005, regulates the sale of pseudoephedrine and other methamphetamine precursors. One key provision is that purchasers must be at least 18 years old and present valid identification. This law aims to prevent the diversion of these products for the illegal manufacture of methamphetamine. Always verify age and identity when selling pseudoephedrine products. Question 25. If a prescription requires mixing a powder with a liquid to create a suspension, this process is known as A. Sterilization, B. Compounding, C. Manufacturing, D. Filtration. Answer B. Compounding. Compounding is the process of preparing a customized medication for an individual patient by mixing ingredients. This often involves combining different components, such as reconstituting a powder with a liquid to form a suspension or solution. Manufacturing, in contrast, involves large-scale drug production by pharmaceutical companies. Understanding the difference between compounding and manufacturing is fundamental to pharmacy practice.